Good afternoon. Today we'll see cardiac poisons. So these are the competencies: FM 10.1, 10.1, 12.1. These are about the various cardiac poisons: aconite, digitalis, oleander, vodalum, and tobacco. So basically the cardiac poisons means these are the poisonous plants acting mainly on the heart by directly or with the help of nerves. The main examples are tobacco, digitalis, oleander, quinine, aconite, and hydrocyanuric acid. So first of all, one of the most important cardiac poison is tobacco. It is also called as nicotinum tabacum. 1 to 8% nicotine is found in the dried leaves, and this nicotine is colorless, volatile, and bitter in taste. Then, the most toxic parts of this plant are tobacco leaves. The active principle, you must remember this: nicotine, or it is also called as anabasine or nornicotine. This tobacco is used in the form of smoking, chewing, snuffing, and insecticide patterns. So this is the tobacco farming. These leaves are then dried and then crushed to form the tobacco, which is consumed in. Then what is the mechanism of action? So mechanism of action, nicotine mostly act on the nicotinic receptors. These receptors are found in the autonomic ganglia, adrenal medulla, central nervous system, spinal cord, neuromuscular junctions, and chemoreceptors of the carotid and aortic bodies. This nicotine is absorbed mostly through the skin and mucous membrane of the lungs. It is metabolized in liver and the. Now, what is the fatal dose? 40 to 60 milligram of nicotine is fatal to the human body, and 15 to 30 gram of crude tobacco is the fatal dose of this tobacco. Then, what is the fatal period? 5 to 15 minutes is the fatal period of this tobacco. Then clinical features. The clinical features are basically divided into acute poisoning and chronic poisoning. So acute poisoning, in acute poisoning, there's a pain in abdomen, nausea, vomiting, and diarrhea. And in acute poisoning, there is a tachycardia followed by bradycardia. The blood vision is one of the most important clinical features seen in these patients. And finally, there may be a death in these acute poisoning cases. Then chronic poisoning. Chronic poisoning is also called as nicotine addiction. These are seen mostly in the smokers and tobacco chewers. This tobacco causes the physical dependence, which is manifested by recurrent craving for the tobacco. In some cases, you may see impaired memory and tobacco amblyopia, that's the blindness. The cause of death in these patients is mainly due to respiratory failure and cardiac standstill. Then what are the complications? So the main complications includes carcinoma of lungs, esophagus, mouth, larynx. Then smoker's cough, bronchitis, this is also observed. And then thromboangiitis obliterans. You have to remember this point. Thromboangiitis obliterans may be caused due to tobacco consumption. Then one of the most important complications in tobacco chewers is due to this maternal smoking. In mothers, it may cause spontaneous abortion, fetal death, abruptio placentae, placenta previa, and low birth weight babies. How will you manage this case? If you found the case with tobacco poisoning, then you have to give gastric lavage with activated charcoal to these patients. Then you have to administer benzodiazepines for the convulsions and then symptomatic treatment. Treat the patient symptomatically. Then what are the autopsy findings? In case of postmortem findings, you will see brownish stains over the skin, then brownish froth at mouth and nostrils, then signs of asphyxia, and then tobacco smell from the mouth and nostrils, and then brownish discoloration of the GIT, that is esophagus, gastric mucosa, etc. Stomach may contain fragments of the tobacco leaves if they are ingested by these patients. These are the main autopsy findings you will observe in these cases. Then what are the medical legal importances of these cases? The accidental poisoning may occur due to overdose or overconsumption of this tobacco. Then occupational hazards at the occupational sites. Then malingering may be seen in some patient to induce the illness. The suicide and homicide. These are the rare medical legal importance, or rare cases it is seen. The second poison is called as digitalis purpura, or this is digitalis or foxglove. This poison is very important because it acts on the heart and it has the most potent action. The roots, leaves, and seeds contain the glycosides. These are very dangerous to the heart. Then digitoxifin, digitalis, digitaphane, these are the active principles you may see in these plants. Then action. This plant acts to these glycosides which directly act on the heart muscles. It may cause bradycardia, extrasystole, ventricular fibrillation, and heart blocks. Next, signs and symptoms. Signs and symptoms of this poison includes nausea, vomiting, abdominal pain, and diarrhea. On the heart, this may show the bradycardia, heart block, extrasystole, and ventricular fibrillation. The respiration in this case may shows slow and sighing respiration. And finally, convulsions and may lead to death in these patients. What are the fatal dose and fatal period? So 15 to 30 milligram of digitalin and 5 milligram of digitoxin. These are the dangerous doses or fatal doses seen in these cases. So what is the fatal period? The fatal period may vary from half hour to 24 hours. Then how will you treat this case? So treatment, stomach wash with tannic acid must be given to this patient, then bowel irrigation, then atropine must be given if there is the evidence of tachycardia, then potassium salts to reduce the extrasystole and monitor the ECG. Then next is Nerium odorum. This is also called as common oleander, white oleander, or in local language it is also called as kaner. The features. These are the shrubs grows all over the India and bears lanceolate leaves. These are white or pinkish in colors. These leaves have clear and thick juice. The all parts of these plants are toxic in nature. You can see this is the white oleander and this is the pink oleander. The toxic principles oleandrin, nerin, and folinerin. This oleandrin is the glycoside poison, and other two, nerin and folinerin. You have to remember these toxic principles. Then what is the mechanism of action? This glycoside have digoxin-like action and inhibit the sodium potassium ATPase pump. Then what is the fatal dose? So 15 to 20 milligram of root, 5 to 15 leaves. These are the fatal doses of this poison. And what is the fatal period? 24 to 36 hours is the fatal period of this poison. So what are the clinical features? Clinical feature includes nausea, vomiting, diarrhea, tachycardia, and breathlessness. So what is the medical legal importance of this case? So this root of this plant is used to cause criminal abortion in the local areas. Accidental death may be occurred due to folk medicine. So in folk medicines, they are the plants which are used to treat the cardiac illness, diabetes mellitus, carcinoma, epilepsy, etc. So in these cases, there may be evidence of accidental death. Cattle poison or animal poison. This plant may be used as a cattle poison or animal poison. Suicide, homicide is rare. The common oleander resists decomposition and burning. Thus, this poison can be detected from the decomposed bodies or ash of the burned bodies. How will we manage this case? So this case can be managed with gastric lavage, activated charcoal, and then give atropine if there is a tachycardia and symptomatic treatment. So what are the autopsy findings? In this case, congestion of organs and petechial hemorrhages over the heart. These are the autopsy findings, but there is no any specific findings in the poisoning. The next poison is Cerebra thievetia. This is the botanic name given to yellow oleander, or it is also called as pila kaner in local language. The features: this shrub resembles the common oleander. Flowers are large, bell-shaped, yellowish in color. The fruit is diamond-shaped or globular in shape. This fruit contains the single nut, and this single nut contains the 5 yellow seeds. So you can see here, this is the yellow oleander. This is the single fruit. This is globular fruit, and this is the nut. Here you can see these are the seeds containing these nuts. Okay. Then about toxicity, all parts of this plant are toxic, but the seeds and roots are more toxic. About these toxic principles, remember this cerebrin, thiovetin, thiotoxin. These are the toxic principles of this plant. Fatal dose 8 to 10 seeds, 15 to 20 gram of root, and 5 to 10 leaves are toxic in nature or fatal in nature. Now about fatal period, 2 to 3 hours. If powdered root is taken, it may be fatal to human life. Clinical features: the milky juice is applied to skin, may produce or may cause inflammation, numbness of mouth and tongue if it is ingested, then vomiting, diarrhea, headache, giddiness. These are the common features seen. There is a loss of muscle power, cardiogenic shock, jaundice, and renal failure. These are the main clinical features seen in this poisoning. ECG changes: sinus tachycardia, atrioventricular block in lead 1 and 2, flattening or inversion of T wave, ST depression, and ventricular and atrial ectopics. These are seen in ECG changes. So how will we manage this case? Management includes gastric lavage with activated charcoal. Then arrhythmias may be treated with atropine. Then administer anti-digoxin fab fragment. Remember this point for MCQ. Then autopsy findings, there is a subendocardial and perivascular hemorrhages with focal myocardial edema. Same. Then the next poison is aconite. It is also called as monkhood, blue rocket, meetha zehar or bish. It has nicotine, Aconitum napillus. It is the European variety, and Aconitum ferox. This is the Indian variety. It is mostly found in the Himalayas. So the features, this feature includes, this is the perennial plant with deeply cut leaves and long spikes of deep blue color flowers with upright stalks. The upper sepal of flower resembles a hood or helmet or a cowl. That's why it is called as monk hood. You can see here, this is the blue flowers with upper sepal is a hood-like pattern. And this is the root of this aconite plant. The root is stout, dark, conical, and shows scars of the broken rootlets, and it is the wrinkled in nature. So toxic part. Toxic part includes this root is the most toxic. Seeds and foliages are also toxic to some extent. There are number of active principles you will see in this plant. These are the aconitin, mesoaconitin, hypoaconitin, pseudoaconitin, indaconitin, big aconitin, and aconine. These are the active principles seen in this aconite plant. What is the mechanism of action? This aconitine acts on the nerves by opening the sodium channels. It also inhibits the complete repolarization of membrane of myocardial tissue, causing repetitive firing. So it stimulates the vagal medullary center. Metabolism. This aconitine is hydrolyzed to benzoaconitine with the help of this enzyme esterase. Fatal dose 1 to 2 gram of root and 3 to 5 gram of aconitine is fatal. Then fatal period, so 2 to 4 hours is the fatal period of this aconite plant. So which are the clinical features? Nausea, vomiting, salivation, tingling, numbness in mouth and lips, palpitation, hypotension, ventricular ectopics. These are the clinical features. Then arrhythmia is the most commonly seen in these cases: vertigo, blurring of vision, which includes mydriasis and hippus xanthopsia. These are the points you must remember for MCQ: mydriasis, hippus, and xanthopsia. Finally, the convulsions, which is followed by death. This is seen in these aconite cases. Then management: how will you manage the case? So give a gastric lavage with activated charcoal. Okay, then benzodiazepines for convulsions, then symptomatic treatment. In this plant, autopsy findings, there is a no specific autopsy findings. Organs are mostly congested in nature. That's it. So this plant is also called as ideal homicidal poison. Medical legal importance. So as I say, this is the ideal homicidal poison because it is sweet in nature and can be given with pan or foodstuff. Aconite gets easily destroyed by decomposition and may not be detectable in any type of chemical analysis. The suicidal, it may be used in suicide cases. Then accidental poisoning, it may occur because it is confused or by mistake it is consumed as a horseradish, which is the then roots used to procure abortion. Then it may be used in a arrow poison or cattle poisons. The last poison is cyanide. It is used in a three forms: gas, liquid, and solid. In the gaseous forms, it is used as hydrogen cyanide. Liquid form, hydrocyanic acid, or it is also called as prussic acid. And in solid form, the salts of this cyanide, potassium cyanide or sodium cyanide. What are the sources? These are found in the bitter almonds, sorghum, bamboo plant, apricot, and peach. These are the bitter almonds. So, the absorption. If this poison is ingested, then in stomach, the cyanide is absorbed in the form of this hydrocyanic acid in the HL. Then enzyme rhodanase, you have to remember this enzyme rhodanase, the hydrocyanic acid is converted into thiocyanate in RBCs. If the inhalation is formed, it is inhaled, then cyanide gas is rapidly absorbed from the respiratory system. Then in the dermal forms, when this acid is applied over the skin, then hydrocyanic acid is absorbed through the skin. Then what is the mechanism of action? Cyanide inhibits ferric ion containing enzymes. That's why it may cause histotoxic anoxia. Remember, this histotoxic anoxia is caused due to this cyanide poisoning. Then what are the fatal doses? 15 to 100 milligram of hydrocyanic acid, 200 to 300 milligram of sodium or potassium cyanide, and 50 to 100 bitter almonds may be fatal. Okay, and the most dangerous form is inhalational part. So one part in 2000 hydrogen cyanide may be fatal. Then what are the fatal period? 2 to 10 minutes is the fatal period. So clinical features in the inhalational form, the constriction around the neck, dizziness, loss of consciousness, coma, and death. If it is ingested, there are wide variety of signs and symptoms are seen. on the CNS, CVS, RS, and gastrointestinal system. Chronic poisoning, in this case, headache, amblyopia, optic atrophy, peripheral neuropathy, ataxia, deafness, glossitis, and stomatitis. These are the features you will be observed in these patients. Then how will you manage the case? So ingestion from gastric lavage with 5% sodium thiosulfide. Okay, then antidote for this cyanide poisoning is amyl nitrate. Remember this for MCQ multiple times. It is asked amyl nitrate for cyanide poisoning. Then sodium nitrate gives slowly infusion. Then sodium thiosulfate 25% of solution in intravenous salines. This is the management of cyanide poisoning. Autopsy findings, which are the autopsy findings? Bitter almond-like smell, cherry red color of potassium, this postmortem lividity. This is the specific findings observed in this cyanide poisoning. Then cyanosis due to asphyxium, then froth at the mouth and nostrils, then bright red color blood. Serosal surface of mucosa may shows hemorrhages. The stomach mucosa may be eroded and blackened due to formation of alkaline hematine. You have to remember this. Then medical legal significance or medical legal importance of the cyanide poisoning. Suicidal use of cyanide is not common, but it may be used in some occupational groups. Then homicide may be observed in these cases, accidental in the particular industries or laboratories may be observed. Then embalming interferes with the cyanide detection. Therefore, interpretation in post-mortem period may be difficult regarding this cyanide poisoning. Okay, thank you.